Hello everyone, I am Dr. Tawab Khalil, co-chair of ISPRM Communication Committee, and today I have with me Pauline Kleinitz, who is actually a trained physiotherapist in Australia, and she has masters in social science and PhD. She will be delivering her keynote lecture in the upcoming ISPRM Congress in Sydney on 3rd of June on the topic of strengthening rehabilitation in health systems. What is it and how does it work globally? So Pauline has actually worked as the technical advisor for WHO headquarters of rehabilitation program for the last 7 years. And in this role, she has supported the development of multiple WHO resources and initiatives. And prior to this, she has worked as a disability and rehabilitation regional advisor in the WHO's Western Pacific office. And she has provided technical support to over 30 ministries of health. And before joining WHO, she has worked at University of Melbourne's Nozzle Institute of Global Health. She has worked in both the rehabilitation and disability service sectors in high, middle, and lower income countries for the past 30 years. And this has included various research, teaching programs, and management programs, as well as technical advisory and as a practitioner. So, welcome, Pauline. How are you doing today?
Thank you. Very well.
Yeah, so you have a very interesting topic for keynote lecture regarding strengthening of rehabilitation. And would you briefly tell us what is it about?
Sure. So, I'm going to share a little bit about the journey since 2017 when WHO supported the launch of the Rehab 2030 initiative. And I'm going to share the work that's been occurring in countries, some of the key approaches that are used to support countries in terms of strengthening rehab in health systems, and even the technical products that we use when we work with countries. After sharing that journey and some of the progress we've made, I'll really hone in a little bit on the process around strategic planning and just what that has resulted in across countries, and of course, take the opportunity to share some of the challenges and some of the ways forward for supporting the strengthening of rehabilitation in health systems, and particularly maybe in low middle income countries where WHO has more of a focus of its work.
I think it would be very interesting, since you have experience in working with various health ministries in the lower middle income and higher income countries. And I think it would be a very interesting topic to listen to in the conference. So, since you are from Australia and since we all are coming from other countries, so as far as Sydney is concerned, so do you have any like favorite spots in Sydney, or what is your most favorite thing about Sydney that I think, for example, all of us we should do?
Sydney is the most beautiful city, and obviously the feature that stand out the most is the harbour and the water. So the thing you must do is walk along the harbour, walk past where the ferry terminal is, where the opera house is, and really just enjoy, and even the botanical gardens. So just enjoy that aspect to Sydney. Of course, there's lots of great restaurants and cafes as well. And if you want to, you could even go for a swim. So there's certainly plenty to do.
Thank you so much, Pauline, for joining us today. So I would like to remind you all that the program of ISPRM is out. You can access it on the website of ISPRM 2024 Sydney. And Pauline's lecture is on 3rd of June on strengthening of rehabilitation in health systems. What is it and how does it work globally? Thank you so much, Pauline. See you soon in Australia.
You will. And we're glad you're all coming. Great. Thanks very much.